I'm going to game the system to make my report card look better. There's plenty of ways you can game the system. We don't have time to get into it. I'm going to ignore patient preference, ignore my own clinical judgment in favor of the committee. It's not going to help anyone. What you end up with is what you end up with is cookbook medicine. You take all the learning and knowledge of doctors here and you replace it with a committee. All the ideas in the books, they go out the window. The committee tells you how to practice. The money doesn't go to the doctor or from Congress and the insurance company. It goes to the committee, and the committee doles it out. That's what we're going to have. And it doesn't help. There's too much to talk about to describe it even more. I'm going to skip that slide. All right, I want to talk about the individual mandate. Okay? This is the heralded way that they're going to cover everyone, so they say. They're going to tell you, if you don't buy health insurance, we're going to penalize you. We're going to make you pay a tax to the government. If you don't pay the tax, because it's a tax, you'll go to jail. Okay? And this is why Bill McCollum is suing. I'm so glad Bill McCollum is suing. Please support him in every way. There's so many others. But here are your current health care choices, okay? Let's think of insurance like a car. Okay? Let's think of that car as your way you're going to get health care. You get in the car, you drive to the place you need health care. Same thing, you buy an insurance policy, you use the money from that to get health care. All right, right now you have all sorts of choices. You can get an old 57, you can have a modern car, you can have the family Vanagon, you can buy the cheaper version, whatever you need, and it's going to get you to pretty much any destination you need to be in right now. Right now the car prices are too inflated, there's problems, etc., but that's kind of the system we have now. Well, here is what is in the bill that just passed. All right, what we're going to do is say there will now only be 4 types of cars. All right, there will be bronze Cadillacs, and they're all going to be Cadillacs, by the way, because everyone needs to have a lot of benefits that they maybe don't want. All right, everyone has to be covered early on with low co-pays and the like. All right, everyone has to have coverage for a hair prosthesis because the Hair Prosthesis Society just lobbied us for hair prosthesis. Everyone has to be covered for chiropractic and acupuncture and marriage counseling because all those societies just lobbied us and they got me elected with a contribution. Now, this is real stuff. This happens. I participate in this process. I know exactly how it works. All right? So we have Cadillac coverage only. All right, but there's 4 kinds of Cadillacs. There's a scale down. There's the bronze plan. This is actually in the legislation. Bronze, silver, gold, and I think platinum. Okay? These are the kinds you have. This is what you are allowed. In fact, these are the kinds that you're required to buy. Okay? They're all going to be overpriced. You can't get a minivan. You can't ride a bicycle. You can't walk. You will buy a Cadillac or you will go to jail. Period. Now, in Medicaid, this is what they get. Okay? They get the rusted out clunker. Okay, we're going to move 16 million people into Medicaid. They're going to raise the Medicaid eligibility to 133% of federal poverty level. They're going to burden the states with more budget-busting Medicaid dollar commitments. And what happens with Medicaid? Well, it's a car maybe, but you can't drive it very far, all right? And you can't see who you want to see because Medicaid pays doctors about 53% of what Medicare pays. And Medicare is already paying barely break-even prices to a lot of doctors. All right? So what doctor in the right mind is going to see a Medicaid patient that they basically have to shell out money for their overhead every time the patient walks in the door? I have a friend who says if he had a Medicaid patient, he'd like to just give him a check and say, go to the next doctor. It's cheaper. And it's sad. It's a medical ghetto that we've created in Medicaid. The Great Society from 1965 that's going to help the poor has put them in a medical ghetto. And we're going to expand that medical ghetto with more budget busting. So this is what you get. Everyone has to buy this Cadillac. Now the average price for a family of 4 health insurance plan today is about $12,400. The average price predicted, and this is well under what it's actually going to be, predicted for the silver plan, not the gold or the platinum, for the silver plan is $14,100. Okay, that's a 14% increase. A 14% increase in the Affordable Care Patient Act. It's not very affordable, okay? And they're going to give out subsidies. People at lower income levels are going to get government checks to help buy insurance. But the checks won't go to them. The checks go to the insurance companies. $350 billion of subsidies directly into the bank accounts of insurance money. of insurance companies, directly there. And when they run out of money, they're going to be going begging for bailouts just like every other corporate welfare sucker in the rest of the world, okay? And so what do we have? What we get are these income levels for a family of 4. At $30,000, you will pay out-of-pocket premiums of $600 a year. The government will pick up 96% of that $14,000 tab, and you will be responsible for paying out-of-pocket $5,000, but because you're poor, we're going to give you an additional check. This will actually probably be a check directly to the recipients of $3,300, and so what you are really going to spend, God, I can't see this.
$2,300.
Yeah. What these people are going to be forced to spend out of pocket $2,300 a year to get all the benefits of their health insurance plan. Forced to spend 8% of their income on an insurance product that they probably don't want because they probably would rather have a bicycle or a Beetle than a Cadillac. Okay? Forced. And that's at the lowest end. As we go up, the subsidies go down. Okay, when we get to $54,000 family income, okay, mom and pop, 2 jobs, scraping together $54,000 to get the kids taken care of in our government-run school system, okay, they're going to have to pay out of pocket $4,000. They're going to get a 72% subsidies, but now they're going to be required to pay out of pocket $5,000. $5,000 in deductibles and copay out of pocket in order for them to get the maximum benefit out of their insurance plan. In other words, their percentage of income will be, hold on.
$9,000.
Yeah, $9,000 cost. 17% of their income. 17% of their income has to go to health care. Can you imagine adding a new 17% income tax to people?
Even if they never use
That's
it
what
all
they,
during
even
the
if,
year?
well, if they don't use it, then they don't have to spend the $5,000 for out-of-pockets and deductibles. That's what they're counting on, is that people won't use their insurance, that the gatekeepers and managers will prevent people from spending money. As you go up, $78,000, you're going to get a taxpayer's subsidy of $44,000, $90,000, 35%. At $102,000 total earned income, you get 0% subsidy. Now, let's check this out. God forbid, your child gets sick, all right? You've been forced to spend for the health insurance for a $14,000 policy out of pocket about $6,100. You are now forced to spend out of pocket $5,000 in order to get the full benefits out of that insurance plan. Once you get into all the benefits, then you'll discover it's rationed. Then we're going to run into the scarcity of resources, and we're going to run into all the committees telling doctors how to practice medicine. What you're getting is a car that will take you nowhere, run into roadblocks, have fewer hospitals and doctors to access, and once you get in the office, you're not going to be able to get what they provide you. That's not good health care. That is basically socialized medicine. They just did it another way. They hid the money with the insurance companies instead of keeping it in the hands of the government. So again, when you drive this Cadillac, you got to drive it where you're told. You're going to be tracked by GPS. It's going to be in the database, okay, if we take the car analogy to its limits, et cetera, okay, and you're going to be denied access to much care. So what was forgotten? Patience. This is what we have now, a low copay model. It takes you $10 to see your doctor. You sit there for an hour waiting to see the doctor. All right, you get in to see a nurse. You finally see the doctor for 3 minutes after seeing the nurse maybe for 10 minutes. They order a bunch of tests that are probably not needed, because when they order the tests, they can have you come back to hear about the tests. They can give you the pill, and when they give you the pill, then they can order a test to make sure your blood is okay. Cha-ching! Okay? There is no one saying, Doc, can you prove to me that a 40-year-old man needs cholesterol medicine for the rest of his life, and that it's appropriate for me to spend to get a blood test every 3 months? Why do I need a blood test for my liver every 3 months for the rest of my life if this is good for me? I don't get it. Can you please explain how many people you have to treat in order to save one life? Oh, it's 250? I think I'll go without the pill, okay? You don't have those conversations now. Okay, Doc, I'll get the pill, come back for the test. Inflation, okay?